All right, let's go ahead and get started. I know we're right at 8 o'clock. So, welcome everyone to the intersection this morning. I am Jessie Higgins. I am the Chief Mental Health Officer for the City of San Antonio. And I have known and admired Anne Helmke for years before getting to be her coworker, and have been able to watch and be a part of the intersection at different times. I remember joining a lot during when it first began during COVID and having it be such a great touch point. And so Anne is traveling today and asked me to host this morning's meeting, and I just couldn't be more honored. I like that Billy, who's also helping us here, changed his name to Billy Cox for Traveling Anne, and I feel like anytime I mean I wanted to be like Jessie Higgins and Helmke's understudy. That would be a great title to have. So thank you all for joining. Just want to open it up to see if anyone has any announcements or has anything they'd like to say to the group before we jump in.
Yes, Jessie, this is Peter Onofre with New Life Christian Center.
Morning.
Good morning. So New Life Christian Center is going to be hosting a homeless town hall. Councilwoman Adana Rocha Garcia will be moderating. We'll have Department of Human Services, as well as Corazon Ministries, Haven for Hope, and other agencies that will be presenting with a great opportunity to provide feedback and get an update on the current state of our homeless population in San Antonio. And that'll be this Monday at 6 p.m. at New Life Christian Center. And I'll put it in the chat.
Yeah, thank you so much for letting us know. That's going to be, I'm sure, a really good conversation. Thank you for hosting that. On behalf of the city, thank you for hosting that.
You're welcome.
Anyone else have anything? All right, hearing none. I'm going to go ahead and jump right in. So today our special guest is the Reverend Dr. Q English. She is the director of the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services. She's coming to us live from Washington, D.C. I can tell you she has a 202 area code. She's legit. She works closely with the White House the White House Office of Faith-Based and Neighborhood Partnerships. The Health and Human Services Center's core focus areas include addressing COVID-19, maternal health, mental health in youth, suicide prevention, and substance use disorder, inclusive of overdose prevention. While working with the operating divisions housed within the Health and Human Services, like the Center for Disease and Prevention Control, or the CDC, and Substance Use and Mental Health Services Administration, or SAMHSA, and the Administration for Children and Families, Reverend Dr. English and the center seek to address the priorities identified by the Biden-Harris administration. So thank you so much, Dr. English, for being here with us today. I just read the first paragraph of your bio. I'll actually drop that in the chat for those who want to see your website and learn more about you. Anything else you'd like to add? Nope.
No, I just hail from New York City. So yeah, probably the only thing I'll add to that.
Yeah, native New Yorker. Tell us a little bit about your work. I know what I just read sounds amazing, but it also sounds huge, and I'm sure you could help narrow it down for us a little bit.
Yeah, absolutely. So when you think about maternal health, right, you think about the U.S. has the highest maternal mortality rate than any developed nation in the world. With our Black women and American Indian and Alaska Native women topping the charts in that regard, 3 to 4 times higher than their white counterpart, and for American Indian, Alaska Native 2 times higher. And so our goal is really just to make the U.S. one of the safest places for women to give birth. And to that end, we do a lot of work in that space. We have launched the first national moms tour, Maternal Outcomes Matter, where we are actually going to the communities with high maternal mortality morbidity rates and connecting our women real time to services. One of the top services that are needed in mental health. We got 52% dying in postpartum stage And so we connect them real time to culturally competent services. In addition, many don't even have healthcare. So we connect them real time to that. Vaccinations, breastfeeding, lactation support, even support through doulas and midwives. So that's a huge undertaking. We started out in Detroit, had over 500 show up. And there was a lot of pregnant women in the house, but being able to connect them real time to services and support and those that are on the ground that do maternal health work has been extraordinary. And we get them there by throwing a community baby shower. So that's the genius behind that. But that is our goal there. And we're coming out with our first maternal health toolkit for the faith community and what you can do in your space to address it. We also have toolkits for youth mental health. As you know, the Surgeon General declared it a national emergency, youth mental health. So we created a toolkit, and our newest toolkit is on suicide prevention for youth. We did it in partnership with Faith Alliance and SAMHSA. And so we're just have to keep moving in these spaces because these numbers of these atrocities are growing, and we are doing as much as we can. And obviously it's not just rely on the government, it's faith community, it's just community, it's our neighborhoods, it's the people in the neighborhood. We all have to work together in order to address some of the atrocities that we're seeing. And so we also addressing substance use disorder at the highest numbers in 2021 as far as deaths, and we know a lot of things happening around opioid and fentanyl. And so we have a lot of work to do. But what we're working on is making sure we get these toolkits out, making sure we get these public service announcements out through trusted messengers, through the faith community, interfaith, so that we can get in front of some of these atrocities.
Yeah, thank you for that. It's hard to see these numbers rising when so many of these things are preventable. And if people had access to services and care and even whittling down the stigma a little bit more, I think we could really help with these numbers.
And just to your point, Jesse, 84% of pregnancy-related deaths are preventable because we're dealing with healthcare disparities, we're dealing with racism, we're dealing with, some things that are just part of our community, from high blood pressure, hypertension. So there's a lot that we're dealing with in that space. And so when you hear that preventable word, we do need to do more.
Yeah, it's work worth doing, even if it's difficult. It's preventable, but not easy, and it's complex, but you're helping to at a federal level coordinate things that we're trying to also work on at the local level.
Yeah, absolutely.
So we met you when you came in August to the Pathways to Hope conference, which is a conference that's largely focused on mental health with the faith intersection there. What did you notice about being here in our space? And I'm going to ask for the pats on the back first, but then we'll talk about the challenges. So what were there strengths that you noticed? Was there things that you're like jazzed about when you were here in our space?
Absolutely. I just think that the efforts just in San Antonio are a model worth highlighting around the country, because you're doing what it takes to be inclusive of community, faith, and you've got that, you got it working. And when I was there at that conference, just to hear the different pillars and the different modules and how they're all coming together, not just faith leaders, but how do you incorporate faith into this conversation and bringing so many faith leaders alongside of you with government and community. That's the ideal model. And you're doing an incredible job in that. So I was very impressed, and I was just honored to be a part and honored to be invited.
Well, thank you for making the trip. And we are proud of the work we're doing, but we do want to make sure that we're doing, best practices, anything we have to learn as you're taking a bigger, you get to zoom in by going to cities, but you also get to see the bigger picture. What opportunities do you see for us to grow and move in the space of mental health and sort of learn from other places?
I think I would encourage everyone on this line and everyone that's listening to really hone in on the stigma piece And I share that story everywhere I go because of my own upbringing and my own challenges in the mental health space. And my own challenges even as a leader, and just sort of creating that busyness to not address what was really happening. And I talk about leading while bleeding. And it's important that, with my stigma, growing up, it was all about what went on in the house stayed in the house. And that some things needed to come out of the house. I shared the story of my brother pushing a shopping cart down 125th Street with matted hair and, not making sense, in his conversations, and my father with PTSD, and my sister's addicted, and my brother addicted, and the HIV/AIDS, and my 14-year-old nephew committing suicide while the 10-year-old watched. It's all of those things that if we don't really encourage our constituents and those we love to seek help, we are going to exacerbate the problem, right? And so it's not enough to just, talk about it, right? You have to dig deeper into some of these pieces. You have to, and I would encourage you, do more in the space of addressing stigma. Create your own PSA, right? Do something that with trusted messengers from from the people that you work with. Share it throughout San Antonio. We created our PSA. It's being shown nationally, obviously, but you can make a difference by having trusted messengers share their lived experience and point people to help. We advocate for 988. We also have a maternal mental health hotline. So I would encourage to do more in that space, utilize social media even more extensively, and really work on culturally competent care and expanding that workforce in any way you can, including more in that space, identifying them, bringing them on board, because if we're the ones that are topping the charts, even now we have our Black boys topping the chart. Where's the culturally competent care there? Where are the mentors? Where are those that should be walking alongside of them to help them through all the things they're going through, right? And so a lot of it is the vicarious trauma that they're experiencing. And so we need to do more in that space. And so I would encourage you to start looking at what does culturally competent lens look like? What does addressing stigma look like? What does understanding the other look like? And then creating even a deeper plan to address those issues. But I would encourage you to but to continue your work by even diving deeper in addressing the stigma, or as people don't like to say stigma, or addressing the fear of seeking help.
Right. The anxiety that goes with saying out loud that you have anxiety, right? That sort of the wondering how people will take it and how to get help and all of that. And so I think of everyone on this call being ambassadors, being people that are trying to be aware of what's going on in the community so that they can say, oh, you need this? I know about that. I actually have heard about that because I'm paying attention, right? And so I think that is really, it's hard to do sometimes. I feel even in the last just few days, I got to the point where I wanted to start looking at some of the coverage from Israel because at first it was too overwhelming to read everything. And so I had to kind of wind up to that. And just thinking about how hard it is to stay aware, but how I feel like it's a calling to have my eyes open and not just trying to care for other people, but so that, I do want to do that, but so that when people ask me, for help or for information, I am aware. I am, trying to gather as much information as possible.
And to your point, this is all based on relationship. And all the ambassadors that's on here, they lead with you lead with empathy, right? And you work to be effective listeners, which I feel is the most effective means of communication, is in our ability to listen. And so, I think, just keep moving in that space of leading with empathy. I'm gonna tell you right now, I have been traumatized over this Israel and Gaza, and we are knee deep in it, as you know, at the White House and at HSS. And I'm a faith leader, and I'm an interfaith, a coalition builder by nature. I've built several interfaith coalitions, which, and so from my Jewish brothers to my Muslim brothers to my Sikh brothers, and sisters. And so this is really hitting hard. And so, but we have to lean on our faith, right? In this time. It is not a religious war. This isn't Israel versus, Jews versus Muslim, right? We're looking at a terrorist attack, but our role as faith leaders is, what does caring for humanity look like? Where do we step in that space? What does looking at through the eyes of faith look like? And what messages are we giving to our congregations? How are we doing what faith does, right? Showing up to create, to provide you, to foster unity and peace and love. And so I think there has to be a refocus and a reimagining in this space. And so, to your point, it's been very difficult for many, and even at our own Health and Human Services, and all the things, that the challenges that go with that. So we do have to. That's why I also say, Jesse, we have to take care of ourselves. And while we're taking care of others, and we have to do that for our own sanity. We're not Superman. We were never called to be Superman 24/7, beyond 24/7. We always say, oh, our people need us, but our people need us well. And so what does well look like for us? What are we doing to take care of ourselves? What are we doing in times, So I think, the titles and, we got to be careful that we are still human. We are still human. And we as faith leaders, we know that God does ordain times of retreat, right? Times of shutting down, or times of just refocusing and meditation. And so I just feel like we need to do more of that for ourselves as leaders. Because, as I said earlier, we are in times leading while bleeding.
Well, and being the example of people who have enough, strength of will to know when they need to take a break and when they need to bow out. And that's showing our own mental health and
Yeah.
the ups and downs that we all go through.
Yeah.
And sometimes as leaders, it's even more, there's more, you feel the weight of what people are going through on a very microscopic, but also a very large global way. And that can be, challenging.
Yeah. Yeah. It can be challenging, yet we have to do it. We have to do it.
So one of the things in your title is about both faith-based and neighborhoods. How do you integrate those two when you're thinking about us taking care of our mental health and taking care of those around us who are struggling?
Well, I think people find themselves. Let me start with this. Our faith community are considered trusted messengers in our community, period, right? And they're the ones that, and I always tell people, we got to think of those, particularly, those that are leading congregations. We have to be like church without walls, right? Houses of worship without walls. And so while, I think of how we integrated and how I did it, on the personal level, is create the conversation on the issues, right? And not so much on the religion right? But what is it that we're facing in our community? Hosting these ongoing monthly meetings is how I did it. And I would invite community, I invite government, I invite the faith leaders, and we focus on it. And then we say, what is it that we can do? I think as I said earlier, one of the most effective means of communication is in our ability to listen. So I didn't come with a script. I allowed them to create the script. And there's a difference, right? It's not, here's what I worked on, sign off on it. That's not what we do. We got to understand that there are community members that bring strength, their own strength. There are faith leaders that bring their strength. The ownership should be all faith and community, and government walking alongside. That's how we led, because it's important that faith takes the lead in many of these issues, right? Because we say, if it pains the heart of God, it should pain us. So if you can create ownership, I ended up with 500 different partners in one of my roundtables.
Wow.
But it was because I created ownership, and I also created different pathways of addressing different issues. So you may have those that were more interested in the education space, those that were more interested in the health space, those that were more interested in gun violence and reducing recidivism and addressing our prison rate. So it was all of those different paths, because that ended up coming together. And so for me, again, it's about everyone owns it. It's everyone's responsibility. What can they contribute to the table in these discussions? Allowing them to have a voice and validate their voice. And even if the voice feels controversial, even if the voice feels like sandpaper, that's okay too, because we don't need to have a cookie cutter approach where everyone sounds like us, thinks like us. The challenges are good. It's the iron sharpening iron. And so coming to the table with openness is important as you engage faith and neighborhood and community.
Right. When you talk about iron sharpening iron and think about it literally, it's not super pleasant. You know,
Yes.
it's hard
Okay.
and it's hot and it's loud and it's grating literally and all of these things. And so going through those things together, but being dedicated to each other, to
Yes.
sorting it out.
Yes. And you always think of, what being able to see things through others' lens, right? And versus then, because if you come with only your lens, then all you'll be is defensive.
Mm.
But if you come with the willingness to see it through other people's lens, then we can start having breakthroughs and dismantling some of those walls that exist. Case in point, when I was in New York, I created the People's Police Academy, hailed by Commissioner Breton as one of the first models of its kind in the nation. And everyone, and I said, I challenged the police department. I said, you have your academy. Why not go through an academy that's led by the community to educate officers that serve in the community but don't live in the community?
Mm-hmm.
And it was a challenge. Everybody said, he's not going to do it. There's no way. He's responsible for broken window. He's this, that, and the other. But my focus wasn't that. My focus was the goal. In that focus, I had to be able to see what they were saying through their lens, and they had to do the same. It took us a minute to get it off the ground, but we did it. And it's now continuing, even in my absence. I'm in New York City and expanding to other public safety agencies. But my point is, you have to be able to have these hard conversations and be able to just keep your mind focused on that end goal. Because for me, if I feel like my Heavenly Father told me this is the path I need to take, then I come from a posture of it's already done.
Mm.
So I always come from that posture. I don't think that it's not going to happen if I feel He told me this is what I'm supposed to do. So I prepare myself for the bumps, for the closed doors. For me, if the door closes, then it wasn't the right door. And it's okay. And I'm going to push and I'm going to struggle until we get the breakthrough because it's already done. So I take that approach in a lot of the things that I've created from the Traffic Free NYC in New York City. It was a hard push to have a community-led initiative to combat human trafficking and then bring everybody to the table, all of the heads of all of the agencies out in the city that, my organization was not on my watch, bringing them all to this table and then bring all of government to the table. That was not an easy task. And then in the room, the conversations that would erupt and just being able to facilitate because there was an end goal. And at the end, we did get the funding to increase outreach for human trafficking victims. And we also were able to change the name of the office to include that. And so keep your eyes on the goal. Keep your ears close to God's mouth. And hear His instructions and don't give up. Has there been times like even in government that I felt like this is a heavy lifting? Maybe I should just, yes. But then I'm reminded, of someone gave me this statement. It was, he said, and it wasn't, he didn't even know what I was going through, but that he said, how do you know that if God didn't give you this mountain so that you can show others that it can be moved?
Mm.
I landed there and we moved that mountain, and that mountain was making sure that mom's tour got off the ground.
Mm.
And it
Well,
did.
Thank you so much for reminding us of how important it is to stay grounded in our purpose. And I don't mean like the intention of the day or why we're here at this meeting, but why we're here on the earth. And that we are extremely powerful as individuals and even more powerful together. And that if we can stay in that, we can definitely affect the change that we need.
Yes.
One last question for you, because I know it's almost our time. Are you coming to San Antonio soon? Are you coming back to see us? Please let
I
us
would
know.
love to come back to see you. All it takes is an invite. That's all it takes is an invite, and would love to see you and continue the collaboration.
Or a mom's tour. I know that we're in definite need of those of that level of research and looking at our maternal mortality rates.
Yeah.
And supporting our moms here in Texas. We're thrilled because we just got Medicaid extended for postpartum for women from 2 months to 12.
Yeah.
And so finally the state is looking at this as a crisis and looking at how much healthcare can, good healthcare that's paying attention to the people it's serving can help people.
Yeah, you're absolutely right. And that is exciting news. That was another heavy lift for HSS in general, but it came through and it's needed, and yes, I will circle back. Let's think about what are the things that we can work together on in San Antonio on the ground, and we can just make it happen. Make it happen.
Well, thank you so much for joining us. I know you've got to go. I feel like this 30 minutes went super fast.
It did.
I appreciate so much of what you've said. So much just reminding us that we're all in this together and we're all probably struggling, but struggling in the same direction.
Yes.
Gives me a little bit of hope that we're working on this together.
And you're doing a great job in doing it. And I just wanted again to applaud everyone here and do take care of yourself. And I was just honored to be a part of this this morning, and also am encouraged. God bless.
Thank you.
All righty. Bye-bye.
So, I just want to say again, thank you to everyone for coming. Anne is traveling. I'm Jessie Higgins. I'm the city's chief mental health officer, and she asked me to sub in for her today. And I appreciate all of you guys showing up on the call. I do have to sign off, but I know that sometimes this remains open for discussion. So if Billy, if you want to keep the line open for anyone who wants to talk, I put at the beginning, and I'll put it in again, Dr. English's the website for her department at HHS, and you can learn more about what they're doing. It's very cool. So I appreciate this opportunity to show that to all of you.
And I'll
Y'all
keep
have a
the
good
line
day.
open for a few minutes in case there's any discussion we need to have. Anyone have comments they want to share about Dr. English message? Arthur, jump in.
I would like to address the issue of cultural competence. First of all, I want to, I guess, apologize if I'm saying anything that hasn't already been developed. But I do believe that I have in my professional journey, I've heard and seen tests of cultural competence where people can understand our own presumptions and perhaps prejudices and assumptions. And so these are tests, simple tests that people can take that can be very revealing in terms of maybe how we might expand our understanding of other cultures. And I personally don't think that anyone is exempt from this. I think we all have to learn from whether it's mental health or race or sex or whatever it is. I do think that there are ways to understand more. And the other issue I want to make is that what she was talking about, script. I do believe that we can hone in on the script. I know that we want input from everyone, but I think our script as we receive it through the media is one of chaos and hostility and demeaning. And I think we are way underutilizing drama and humor. And I think that I hear, well, why don't the Democrats fight back? And I'm thinking, no, I agree with the adult posture that's being presented, but at the same time, I think we're way underutilizing drama and messaging in that way. Thank you.
Very good, very good. Yeah, the cultural competence is a big deal, and not being hung up on the narrative that we're handed through the media. They're a source, but not the final. Anyone else have other comments?
Oh, excuse me, I just want to say one other thing, and that is that if anyone has any information on cultural competence, I would be very interested as Pax Christi, as peacemakers of information on cultural competence and testing. I'm very interested in promoting that.
Good. Well, I think we had a good discussion this morning. It was great to hear Dr. English and her perspective, and really appreciate Jessie Higgins stepping up to lead the discussion with Dr. English this morning. I hope everyone has had a great week so far. Hope you have a great rest of the week. Enjoy fall. Fall finally happened. We get to enjoy a little bit of cooler air. So enjoy the rest of your week and have a great weekend.